The sterile air in the pre-op suite at Joint Base Andrews hung heavy with the scent of antiseptic and the unspoken tension of a high-stakes military operation. Dr. Eris Thorne, barely 30, her dark hair pulled back in a severe bun that did little to soften her sharp features, stood rigid, her gaze fixed on the double doors of Operating Room 3. Inside, a Navy SEAL, Master Chief Petty Officer Kalen Rhino Vance, lay intubated, his life hanging by a fragile thread. Vance, a legend in the special warfare community, had taken a direct hit to the chest during a black op in the Persian Gulf. His transport from the forward operating base had been a blur of frantic radio calls and the rhythmic thrum of a medevac helicopter, culminating in his arrival at Andrews just 20 minutes ago. Eris, a cardiothoracic surgeon, had been pulled from a late-night research paper on novel cardiac bypass techniques, her expertise in complex thoracic trauma making her the first call, despite her relative youth. Dr. Thorne, a word, Dr. Elias Vance, the hospital's chief of surgery, a man whose silver temples and weary eyes bespoke decades of combat medicine, approached her. He was no relation to the patient, but his gravitas filled the room. General Davies is on his way. He's particular about who operates on his men. Eris knew what that meant. Her youth, her gender, her unconventional path to becoming one of the nation's most promising cardiothoracic surgeons, it all made her an easy target for skepticism. She had graduated summa cum laude from Johns Hopkins at 22, completed her residency at Massachusetts General in record time, and had already published groundbreaking work on reconstructive vascular surgery. Yet, the old guard often saw a girl, not a prodigy. "My credentials are in order, Dr. Vance," Eris stated, her voice calm, betraying none of the tremor that threatened to betray her carefully constructed composure. "I have the highest success rate with penetrating chest trauma in this facility." Dr. Vance nodded, a flicker of understanding in his eyes. He knew her capabilities, had even championed her appointment. But military hierarchy was a beast of its own, especially when a SEAL of Vance's caliber was on the table. "It's not about your credentials, Eris. It's about optics. General Davies wants his most experienced surgeon. Dr. Albright is being prepped." Dr. Albright was a seasoned veteran, nearing retirement, whose hands had trembled slightly during their last joint surgery. He was safe, predictable, but not, Eris knew, the best choice for this specific, complex injury. A sudden commotion erupted at the entrance. General Davies, a man whose uniform seemed to have been forged from granite, strode in, his face a mask of grim determination. Behind him, a retinue of colonels and aides followed, their faces mirroring his concern. Davies's eyes, sharp and assessing, swept across the room, landing on Eris. He paused, his gaze lingering, before moving on to Dr. Vance. "Elias, what's the status of Master Chief Vance?" His voice was a low growl, accustomed to commanding attention. "General, he's in critical condition. Massive hemothorax, suspected great vessel injury. We're stabilizing him for surgery." Davies's gaze flicked back to Eris. "And who is this doctor?" His tone was polite, but the underlying challenge was clear. "General, this is Dr. Eris Thorne, one of our most gifted cardiothoracic surgeons." She was the on-call specialist for this type of trauma. Davies's brow furrowed. "Gifted, I'm sure. But I want Dr. Albright. He operated on my men in Afghanistan and Iraq. He knows what he's doing." The implication was unmistakable. Eris did not. Eris felt a familiar prick of indignation, but she held her tongue, her jaw tight. She had faced this countless times, the assumption that her youth equated to inexperience, her gender to weakness. "General, with all due respect, Dr. Albright is an excellent surgeon, but Master Chief Vance's injury is highly specific. Dr. Thorne's expertise in reconstructive vascular techniques, particularly in the aortic arch, is unparalleled here," Dr. Vance interjected, attempting to bridge the chasm of distrust. Davies scoffed, a dismissive sound. "Unparalleled? Elias, I'm not questioning her talent. I'm questioning her experience in this kind of battlefield trauma. Albright has seen it all, the seconds stretched, taut and suffocating." Eris knew that arguing would only solidify Davies's prejudice. She needed a different approach. "General," Eris began, her voice steady, "Master Chief Vance has a laceration to his left subclavian artery, extending into the superior vena cava. The initial CT scan, which I've reviewed, shows extensive hematoma formation, pushing on the trachea. Dr. Albright's experience is valuable, but my recent publications, particularly the one in the Journal of Vascular Surgery on complex revascularization of the subclavian, directly address this type of injury. Time is critical, General. Every minute we delay increases the risk of exsanguination and irreversible organ damage." She spoke with a quiet authority that cut through the general's bluster, her words precise, clinical, undeniable. Davies's eyes narrowed, a flicker of surprise in their depths. He looked from Eris to Dr. Vance, then back to Eris, a silent assessment taking place. He was a man who understood the language of data and competence. He might not like her youth, but he couldn't ignore the facts she presented. The silence in the room was absolute, punctuated only by the faint, rhythmic beeping of monitors from within the OR. Eris met his gaze squarely, her own unwavering. She wasn't asking for permission. She was stating a medical necessity. "Dr. Thorne, I appreciate your confidence," Davies finally said, the words carefully chosen. "But Albright is a known quantity. We don't take chances with my men." Before Eris could respond, a nurse rushed out of OR 3, her face pale. "Dr. Vance. Master Chief Vance's blood pressure is dropping rapidly. His chest tube is filling too fast. We're losing him." The urgency in her voice was a cold splash of reality. All eyes turned to the nurse, then to Davies. The carefully constructed hierarchy, the prejudice, the debate, it all dissolved in the face of imminent death. Davies's jaw clenched. He understood the implications. Delay meant death. He looked at Dr. Albright, who had just arrived, looking tired and slightly disoriented. Then he looked at Eris, whose stance was still, her eyes sharp and focused, already mentally dissecting the problem. Her confidence wasn't bravado, it was a quiet certainty born of deep knowledge. The general had seen that look before, in the eyes of his most lethal operators, just before they went into the breach. "She goes," General Davies said, his voice cutting through the rising panic. "Dr. Thorne, you're on. Elias, make sure she has everything she needs. Albright, you're her first assist." The pronouncement was met with a collective gasp from the surrounding staff. Albright, though surprised, nodded, a flicker of professional respect replacing his initial bewilderment. Eris didn't allow herself a moment of triumph. The stakes were too high. She simply nodded once, a curt acknowledgement, and turned towards the OR doors. "Prep for a median sternotomy. Get the cell saver ready. I need a bypass machine on standby, just in case." Her voice, now imbued with the authority of command, was crisp and clear. As Eris pushed through the double doors, the sterile environment of the OR enveloped her. The air was thick with the metallic tang of blood and the hum of medical equipment. Master Chief Vance lay on the operating table, his chest already draped, a silent testament to the urgency of his condition. The surgical team, a microcosm of highly trained professionals, moved with practiced efficiency around him. Dr. Albright, now scrubbed and gowned, stood opposite her, his expression a mix of awe and renewed focus. "Scalpel," Eris commanded, her voice steady. The cold steel was placed in her gloved hand. She made the precise, vertical incision down Vance's sternum, the blade cutting through skin, muscle, and fascia with practiced ease. The crimson line that appeared was not just a wound, but a gateway, a desperate opening into the very core of a man's life. The sternal saw word to life, its high-pitched whine echoing in the room. Eris guided the blade with an almost unnatural steadiness, splitting the sternum, revealing the ravaged landscape beneath. Blood welled up, obscuring the view, but Eris's eyes, honed by years of practice, saw beyond the chaos. The left pleural cavity was a crimson lake, the lungs collapsed and compressed. The source of the bleeding was immediately apparent, a gaping laceration in the subclavian artery, dangerously close to its junction with the aortic arch, and a tear in the superior vena cava. The injury was far more extensive than even the CT scan had fully revealed. Massive hemothorax, Eris stated, her voice calm amidst the growing tension. Suction. Quickly, the suction device gurgled, drawing torrents of blood from the chest cavity. The anesthesiologist, Dr. Chin, a quiet but highly competent woman, reported vital signs with a clipped urgency. BP dropping to 70/40ths. Heart rate 130. We're losing volume fast. Dr. Thorne. Eris didn't flinch. She had anticipated this. Dr. Albright, begin cannulation for bypass. Femoral artery and vein. We need to get him on bypass immediately to control the bleeding and stabilize him. Albright, moving with a speed that belied his age, began the intricate process of inserting the cannulas into Vance's femoral vessels. Eris, meanwhile, worked meticulously to identify and clamp the bleeding vessels. The subclavian artery, normally a robust conduit, was ragged and torn, a testament to the sheer force of the projectile. The superior vena cava, a major pathway for deoxygenated blood returning to the heart, was also compromised. Each movement was precise, deliberate. The stakes were excruciatingly high. This wasn't just a patient. This was a symbol, a man whose survival represented hope and resilience to an entire community. Clamps on the subclavian, Eris announced, her voice firm. The flow of blood slowed, but the damage was extensive. The torn edges of the artery were frayed, almost impossible to reapproximate without significant tension. Dr. Albright, prepare the Gore-Tex graft. 8 millimeters, Albright nodded, already reaching for the synthetic graft material. The bypass machine, a complex array of tubes and pumps, began to hum, taking over the function of Vance's heart and lungs, buying Eris precious time. Hours bled into a timeless continuum of focus and precision. Eris worked with a surgeon's brutal ballet, her movements fluid, almost artistic, as she meticulously repaired the subclavian artery, suturing the Gore-Tex graft into place. The fine needles, tiny as a hair, danced through the delicate vascular tissue, each stitch a testament to her unwavering concentration. Then came the superior vena cava, an even more delicate repair, requiring a patch graft to avoid narrowing the vessel. Sweat beaded on her forehead, but her hands remained steady. Releasing clamps on the subclavian, Eris announced, her breath held. The graft pulsed with renewed blood flow, a perfect, leak-free repair. A collective sigh of relief rippled through the OR. Dr. Chin reported, BP stabilizing at 100/60. Heart rate 80. Oxygen saturation improving. The tension in the room began to dissipate, replaced by a quiet sense of accomplishment. Eris wasn't done yet. She carefully inspected the surrounding tissues, ensuring no other hidden injuries remained. The bullet had caused a cascade of destruction, but she had systematically addressed each one. Finally, after nearly 6 grueling hours, Eris looked up, her face tired but triumphant. We're good. Off bypass. Prepare for chest closure. The surgical team moved to reverse the bypass, allowing Vance's own heart and lungs to resume their work. The steady thrum of his heartbeat on the monitor was a symphony of life. As Eris began the meticulous process of closing Vance's chest, suturing the sternum back together, she allowed herself a brief, internal moment of satisfaction. She had not only saved a life, she had, in a way, reaffirmed her own. Outside the OR, General Davies paced restlessly, his granite facade slowly cracking under the strain of waiting. Dr. Vance stood nearby, offering quiet reassurances that seemed to fall on deaf ears. When the OR doors finally swung open and Eris emerged, still in her blood-spattered scrubs, her hair slightly disheveled, a palpable wave of relief washed over the waiting room. Davies stopped his pacing, his eyes immediately locking onto her. General, Eris said, her voice hoarse from hours of concentration, Master Chief Vance is stable. We repaired a complete transection of the left subclavian artery with a Gore-Tex graft and a significant laceration to the superior vena cava. He's in recovery, but the prognosis is good. He's a fighter. Davies stared at her, his expression unreadable. Then, slowly, a flicker of something akin to respect, Perhaps even awe, crossed his face. He extended a hand, a gesture of profound gratitude. "Dr. Thorne," he said, his voice softer than Eris had ever heard it, "you have my deepest thanks. You saved one of my best." Eris shook his hand, her grip firm. "It was my privilege, General." She was exhausted, physically and emotionally, but a quiet sense of vindication settled over her. The battle against prejudice, against the assumptions of her capabilities, was a constant one, but in moments like these, it was undeniably worth it. As she walked away, heading for a much-needed shower and a moment of quiet reflection, she heard General Davies speaking to Dr. Vance. "Elias," he said, his voice carrying through the quiet hallway, "make sure Dr. Thorne is recognized for this. And from now on, when I ask for the best, I want her." The words, though not spoken directly to her, resonated deeply, a quiet affirmation that transcended the sterile walls of the hospital. Her expertise, finally, had spoken for itself.